Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today's video, we're going to be discussing a medication known as Sevelamer. Its brand name is Renagel. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, I've put together some slides to go over the information associated with this medication, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Sevelamer hydrochloride, a non-absorbed binding cross-linked polymer, contains multiple amines separated by one carbon from the polymer backbone. By binding phosphate in the dietary tract and decreasing absorption, Sevelamer lowers the phosphate concentration in the serum. In terms of indications or reasons we prescribe this medication to a patient, well, we may see Sevelamer prescribed in end-stage renal disease when a patient is undergoing hemodialysis and has hyperphosphatemia or high phosphate levels. With respect to contraindications or reasons we would not be able to prescribe Sevelamer, well, first of all, we just wouldn't give this medication to a patient who had a hypersensitivity to Sevelamer or any other component of the formulation. As well, if a patient had a bowel obstruction, they would also not use this medication. Now, for an example of dosing with Sevelamer, so in the treatment of end-stage renal disease, when they have hemodialysis and they're experiencing hyperphosphatemia or high phosphate levels, and the serum phosphate level is between 5.5 and 7.5 milligrams per deciliter, the initial dosage would be 800 milligrams or one tablet, orally 3 times a day with meals. We could then increase by one tablet or an 800 milligram tablet per meal at the 2-week intervals for serum phosphate greater than 5.5 milligrams per deciliter. As with all medications, there are some side effects or adverse reactions that patients may experience while using Sevelamer. We'll go over some of those here now. Abdominal pain may happen 9% of the time, and constipation may happen 8% of the time. 19% of patients may experience diarrhea, and 8% may experience flatulence. 16% of patients may experience indigestion, and nausea seems to happen 20% of the time. 22% of patients may experience vomiting. More serious side effects may include bowel obstruction, colitis, dysphagia or difficulty swallowing, as well as a gastrointestinal ulcer. Alright everybody, that's all we're going to talk about today with Sevelamer or Renagel. As always, I'm very thankful you took the time to come and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.